Today, we're talking about the signs of insulin resistance you're probably missing because they don't always show up on a standard lab report. Insulin resistance doesn't begin with diabetes. It begins years, sometimes decades before, long before fasting glucose crosses that diagnostic line, long before A1C triggers a prescription. By the time type 2 diabetes is diagnosed, insulin resistance has often been silently progressing for years. So what exactly is insulin resistance? Under normal conditions, insulin acts like a key. It unlocks your cells so glucose can move from the bloodstream into the muscle and liver where it's used or stored. But when cells become resistant, the key no longer works properly. The pancreas responds by producing more insulin, trying to force the door open. And here's the problem. Blood sugar can remain normal for years because insulin levels are sky high behind the scenes. So your glucose looks fine, but your insulin? Quietly elevated. And that matters. Let's look at the early signs most people overlook. First, increasing waist circumference even without weight gain. You don't have to be obese to be insulin resistant. In fact, some individuals with a normal BMI may carry excess visceral fat, the fat packed around the organs. This type of fat is metabolically active and strongly linked to insulin resistance. If your waistline is expanding even if the scale hasn't changed much, that's a red flag. Second, post-meal fatigue. Do you feel sleepy or foggy after eating? Especially after refined carbohydrates? That energy crash may not just be getting older. When insulin spikes dramatically after a meal, blood sugar can drop quickly, leading to fatigue, shakiness, or brain fog. These swings are often early metabolic warning signs. Third, skin changes. Dark, velvety patches on the neck, underarms, or groin, known as acanthosis nigricans, can signal chronically elevated insulin levels. Skin tags, particularly around the neck or underarms, have also been associated with insulin resistance. These aren't cosmetic issues. They may be metabolic clues. Fourth, elevated triglycerides and low HDL. You might glance at your cholesterol panel and focus on total cholesterol. But insulin resistance often shows up first as high triglycerides and low, good, HDL cholesterol. This lipid pattern is a hallmark of metabolic dysfunction, even if LDL appears acceptable. Fifth, high blood pressure. Insulin isn't just a blood sugar hormone. It affects sodium retention and blood vessel tune. Chronically elevated insulin levels can contribute to rising blood pressure, even before blood sugar becomes abnormal. Sixth, difficulty losing weight despite calorie restriction. If you're cutting calories but the scale won't budge, insulin may be part of the story. Elevated insulin levels promote fat storage and inhibit fat burning. It's not simply about willpower, it's about hormonal environment. Seventh, fasting glucose in the normal but high range. A fasting glucose of 99 mg/dL may technically be normal, but studies show cardiovascular risk begins rising well below the diabetic threshold. When fasting glucose creeps into the upper 90s or low 100s, it may signal underlying insulin resistance. Now here's something rarely discussed: fasting insulin. Most routine labs do not measure fasting insulin. Yet elevated fasting insulin may precede abnormal glucose by many years. Research suggests that fasting insulin above 7-APID/mL may indicate early insulin resistance, even when glucose is normal. In other words, by the time blood sugar rises, the process has been underway for quite some time. And insulin resistance isn't just about diabetes. It's associated with heart disease, fatty liver disease, cognitive decline, polycystic ovary syndrome, and certain cancers. Chronically elevated insulin acts as a growth-promoting hormone. It stimulates pathways that may accelerate aging and inflammation. So what drives insulin resistance in the first place? Excess saturated fat intake can impair insulin signaling in muscle cells within hours. Diets high in refined carbohydrates and added sugars contribute to repeated insulin spikes. Excess calorie intake, especially from ultra-processed foods, promotes visceral fat accumulation. But here's the hopeful part: insulin resistance is often reversible. Whole plant foods, fruits, vegetables, legumes, whole grains, nuts, and seeds improve insulin sensitivity. Fiber slows glucose absorption. Antioxidants reduce inflammation. Weight loss, even modest amounts, can dramatically improve insulin action. In fact, dietary interventions centered on whole, minimally processed plant foods have been shown to reduce fasting insulin levels and improve insulin sensitivity, sometimes within weeks. Physical activity also plays a powerful role. Muscle contraction allows glucose to enter cells independent of insulin. Even a brisk 10-minute walk after meals can blunt post-meal glucose spikes. Sleep matters too. Just one night of sleep deprivation can reduce insulin sensitivity. Chronic stress elevates cortisol, which can worsen blood sugar control. So if you're wondering whether insulin resistance could be affecting you, consider asking your healthcare provider about fasting insulin, triglyceride to HDL ratio, waist circumference, liver enzymes, especially ALT, A1C trends over time. Because insulin resistance rarely announces itself dramatically. It whispers. It whispers through subtle lab changes, through midsection weight gain, through afternoon fatigue, through skin changes we might dismiss. The tragedy is that we often wait for diabetes to be diagnosed before taking action. But by then, the metabolic strain has been building for years. The opportunity lies in early recognition. Insulin resistance is not inevitable with aging. It is strongly influenced by lifestyle. And the earlier we intervene with diet, movement, sleep, and stress management, the more reversible the process may be. So if your labs are almost normal, if your energy isn't what it used to be, if your waistline has quietly expanded, don't ignore those signals. They may be the earliest signs your metabolism is asking for change. Because when it comes to insulin resistance, what you don't know can hurt you. But what you catch early, you can often reverse. One of the most overlooked realities in metabolic health is that blood sugar can look perfectly normal, while insulin levels are already elevated behind the scenes. Most routine lab work measures fasting glucose, not fasting insulin. But glucose is the late marker. Insulin is the early warning system. In the beginning stages of insulin resistance, your cells stop responding efficiently to insulin's signal. The pancreas compensates by producing more insulin to keep blood sugar in the normal range. And it often succeeds, at least for a while. So your fasting glucose might come back at 90 or 95 mg/dL, comfortably within the reference range. Your A1C may still appear acceptable. Yet your body may be working overtime, pumping out excess insulin just to maintain that normal number. This compensation phase can last for years, even decades. During this time, chronically elevated insulin levels may quietly promote fat storage, increase inflammation, raise blood pressure, and alter cholesterol patterns. The metabolic strain builds gradually. By the time fasting glucose finally starts to climb into the prediabetic range, pancreatic beta cells may already be under significant stress. Research suggests that hyperinsulinemia, excess insulin in the bloodstream, can precede the diagnosis of type 2 diabetes by many years. In other words, the disease process begins long before it becomes clinically obvious. Waiting for glucose to rise before taking action may mean missing a critical window for prevention. That's why relying solely on fasting glucose can create a false sense of security. Normal blood sugar does not necessarily mean normal metabolism. It may simply mean your pancreas is still strong enough to compensate. But compensation is not cure. And recognizing this earlier stage offers an opportunity, perhaps the best opportunity, to reverse course before permanent damage occurs. One of the most powerful predictors of insulin resistance isn't the number on the scale, it's where fat is stored. You can maintain roughly the same body weight for years, yet if more of that weight shifts toward the abdomen, particularly deep within the abdominal cavity, metabolic risk can rise dramatically. This internal fat, known as visceral fat, wraps around organs like the liver and pancreas. And unlike subcutaneous fat, the kind you can pinch, visceral fat is metabolically active. Visceral fat doesn't just sit there as passive energy storage. It behaves more like an endocrine organ, releasing inflammatory cytokines, free fatty acids, and hormones that interfere with insulin signaling. These substances can impair the ability of muscle and liver cells to respond to insulin properly, forcing the pancreas to produce more of it. Over time, this contributes directly to insulin resistance. Even individuals with a normal body mass index can carry excess visceral fat, a phenomenon sometimes described as being thin on the outside, fat on the inside. This helps explain why some people who are not technically overweight still develop prediabetes or type 2 diabetes. Waist circumference, in many cases, may predict metabolic risk more accurately than total body weight. An expanding waistline can also reflect fat accumulation in the liver, a condition closely linked to insulin resistance. Fatty liver further worsens metabolic control by increasing glucose production and disrupting normal insulin function. The key point is this belly fat is not merely cosmetic. It is biologically active tissue that promotes inflammation and hormonal imbalance. When abdominal girth increases, even without dramatic weight gain, it may be an early and visible sign that deeper metabolic changes are already underway. Feeling sleepy, foggy, or slightly shaky after a meal is often brushed off as normal, especially with age. But that post-meal slump may be telling a deeper metabolic story. When you eat a meal high in refined carbohydrates, white bread, sugary drinks, pastries, processed snacks, glucose can enter the bloodstream rapidly. In response, the pancreas releases insulin to move that glucose into cells. If someone is developing insulin resistance, the body may release an exaggerated amount of insulin to compensate for cells that aren't responding efficiently. That surge of insulin can sometimes overshoot the mark. Blood sugar rises quickly, then drops just as fast. This rapid decline, even if it doesn't fall into technically low territory, can trigger symptoms like fatigue, brain fog, irritability, shakiness, headaches, or renewed hunger shortly after eating. It becomes a metabolic roller coaster: spike, crash, crave, repeat. Over time, repeated cycles of large glucose swings and insulin spikes may worsen insulin resistance. High insulin levels promote fat storage and inhibit fat burning, particularly around the abdomen. Meanwhile, fluctuating blood sugar levels can affect concentration and energy stability throughout the day. This pattern is sometimes called reactive hypoglycemia, but even without a formal diagnosis, the symptoms reflect underlying metabolic stress. Importantly, this isn't simply about getting older or being tired after lunch. Stable energy after meals is a hallmark of healthy insulin sensitivity. When meals are built around whole plant foods rich in fiber, legumes, intact whole grains, vegetables, and fruit, glucose enters the bloodstream more gradually. Insulin rises more moderately. Energy remains steadier. If you regularly experience post-meal crashes, your body may be signaling that insulin regulation is under strain long before diabetes ever appears. When most people look at their cholesterol panel, their eyes go straight to LDL, the so-called bad cholesterol. But insulin resistance often reveals itself somewhere else entirely. A pattern of elevated triglycerides combined with low HDL cholesterol is one of the earliest and most consistent lipid markers of metabolic dysfunction. Even when LDL appears normal or only mildly elevated, triglycerides are a form of fat circulating in the bloodstream. When insulin levels are chronically high, the liver increases production of triglyceride-rich particles. At the same time, insulin resistance interferes with HDL formation and accelerates its breakdown. The result is a double signal. Triglycerides rise, HDL drops. This combination reflects underlying disturbances in how the body processes carbohydrates and fats. What makes this particularly important is that these changes often appear years before blood sugar crosses into the prediabetic range. Someone may be told their glucose is fine, yet their triglycerides are creeping upward and HDL is slipping downward. That lipid shift is not random. It's part of the metabolic cascade driven by insulin resistance. The triglyceride to HDL ratio has been proposed as a simple way to estimate metabolic risk. A higher ratio is associated with increased insulin resistance, greater cardiovascular risk, and higher likelihood of future type 2 diabetes. It can also signal the presence of small, dense LDL particles, which may be more atherogenic even if total LDL cholesterol seems acceptable. In other words, a normal cholesterol panel isn't necessarily reassuring if triglycerides are high and HDL is low. That imbalance may be the body's early warning system. Long before diabetes is formally diagnosed, that insulin metabolism is under strain and cardiovascular risk is quietly increasing. The encouraging reality about insulin resistance is that it is not a one-way street. Unlike many chronic conditions that progress steadily over time, insulin sensitivity can improve, sometimes surprisingly quickly, when the underlying drivers are addressed. And the most powerful tools are not exotic medications or complicated regimens, but foundational lifestyle changes. Whole plant foods, vegetables, fruits, legumes, intact whole grains, nuts, and seeds are naturally rich in fiber and phytonutrients. Fiber slows the absorption of glucose into the bloodstream, preventing sharp spikes in blood sugar and excessive insulin release. At the same time, plant Plant-based diets tend to be lower in saturated fat, which has been shown to impair insulin signaling in muscle cells. Within weeks of shifting toward a fiber-rich dietary pattern, studies have documented improvements in insulin sensitivity and reductions in fasting insulin levels. Weight reduction, even modest amounts, 5 to 10% of body weight, can significantly improve insulin responsiveness. Much of this benefit comes from reducing visceral fat, which is strongly linked to metabolic dysfunction. As abdominal fat decreases, inflammatory signals decline and insulin pathways function more efficiently. Physical activity amplifies these effects. When muscles contract during walking, cycling, or resistance training, they can take up glucose independent of insulin. Regular movement essentially gives insulin a helping hand, lowering circulating glucose and reducing the need for excessive insulin production. Sleep is often overlooked, but equally critical. Inadequate or poor quality sleep can impair insulin sensitivity within days. Restorative sleep helps regulate hormones that influence appetite, glucose metabolism, and inflammation. The key message is empowering early detection offers early opportunity. When insulin resistance is addressed before glucose rises dramatically, the metabolic system can often recalibrate, sometimes within weeks, shifting the trajectory away from diabetes and toward long-term health.